Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Vendor Education Series, and I'd like to welcome you to our latest session presented by the SIFTWELL team. And they will be discussing applying AI frameworks to the timeless challenge of retention, quality, and outcomes. But before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be posting today's call, and for our ACAP plans, we will post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. And while you're there, you can post an inquiry, an RFI, or even an RFP on the Preferred Vendor Connection portal. And of course, during today's session, you can ask a question at any time by clicking the Q&A icon in your Zoom window and typing in your question. Now, I'll pass it over to Trey to get things started.
Awesome. Thank you, Ron. And today's conversation is about retention, the application of AI to the challenges associated with retention. I will say, if anybody's got questions about Beanie Babies, we had a really good discussion leading up to going live here about Beanie Babies. So I'm sure the crowd here, the panelists, could answer any questions about that as well. So, but let's get into it. My name is Trey Sutton. I'm one of the co-founders at SIFTWELL. Prior to SIFTWELL, had the great opportunity to be the CEO of another ACAP plan that was mostly Medicaid, also a CFO of Medicaid North Carolina. SIFTWELL was a company that I wanted to build as the tool that I would have loved to have had in some of my previous roles. Was on the board of ACAP for a little bit, and so always really excited and pleased to be doing anything co-hosted by ACAP. And so, Ron, thanks for your help today. Before we dive into the topics for today's conversation, I do want to give my fellow panelists an opportunity to introduce themselves. So Blair, why don't we start with you?
Sure. Hey, everyone. It's Blair Fiesa, and I serve as CEO of Mountain Health Co-op, which is an ACA plan, and we cover Montana, Wyoming, and Idaho. Renee?
Awesome. Thanks, Blair. My name is Renee Malone. I help lead our customer success over here at SIFTWELL. And prior to that, I would say by trade, should I say, I'm an ER nurse by trade and worked in a variety of clinical and operational roles. So have definitely seen the pain points and challenges experienced from multiple different perspectives, and really excited to be able to talk through today how we're able to really take teams and accelerate them to the next level together.
Awesome. Thanks, you too. All right. So today, a couple objectives for today's conversation is, first, we want to talk a little bit about the changing landscape. We want to talk a little bit about how to identify members that are most likely to voluntarily disenroll. How might there be some strategies to engage those members? There is going to be a little bit of broader context just about the landscape, so to speak, of AI technologies. That has nothing to do with SIFTWELL. It's just a broader view on what we're seeing in the market generally. Some things about how to think through buying decisions. Do you build something? Do you buy something? Do you rent it? What are some of the ways that folks are thinking about this? And Blair, we're really going to want to hear from you, since you've been through that decision process now a few times. And then Renee and Blair will kind of tag team a discussion a little bit about some practical applications of AI in the space of retention and member engagement. So we're looking forward to that part of the conversation as well. Just by way of setup, though, kind of framing the challenge, if you will, retentions has been a massive problem for health plans, over the last couple of years. We had in the Medicaid space the public health emergency unwinding. Now we're rolling right into a change in legislation that will drive folks off the roll as a function of administrative burden. Kaiser Family Foundation is talking that the impact of that on various Medicaid plans could be as high as 19%. Blair, we'll get into a little bit about what's happening in your space. Big questions about the premium tax credit. There was bits in the new legislation about some of that. So, I just want to frame it up there. Well, Blair, Staying on the topic of the marketplace, in the ACA and tax credits, all the rest of it, can you talk to us a little bit about some of the biggest challenge you're navigating across, retention, quality outcomes, retention being the main focus of today's conversation?
Yeah, absolutely. And great question. It's expansive. So I'll start with a couple thoughts and hopefully I don't meander too much. But the ACA marketplace is a really hard market to get the right data in. For us specifically, we have folks in and out of Medicaid, in and out of group plans, back on. So you don't really have that consistent data throughout. So that's really hard to help with any other sort of retention tool. By and large, the ACA as a whole doesn't retain members for the long period of time. So the longevity is short. I was thinking back to this as you were doing your intro that, it was only, I want to say 5 or 6 years ago that our retention was at about 68%. Now, today, it's in the high 80s, which is really great, but that's come with a lot of work. Now, you put that into where we're at today, and we're in a holding pattern, right? And I think everybody on this call is in the same holding pattern. Are we going to pass those tax credits? If not, we're all fighting for a smaller pool, a smaller piece of the pie. We're all anticipating 20 to 30% of folks coming off of our rolls. And the people we're going to stay on are really sick because they need a plan and they're going to have to pay that extra cost. So, what does retention look like? Historically, 5, 6 years ago, where we were just trying to keep all the bodies we could because we needed that, to now saying, how do we show value to our plan beyond just health insurance? So what are those value added props per demographic? So maybe younger people look at it differently than those that are just right before, needing that med sup plan. How are we going to keep the people in the right rating areas and the right pockets? And so it's shifted a little bit, which is why I'm glad we've already been working on this retention problem, because now we're able to get a little more specific as we move forward. But I think all of us, on this call and we're listening in are in the same, how the heck are we going to keep these people enrolled? And I think we have to look longer term as well, because the folks that fall off this plan and then use care, we're going to end up paying for it on the back end because hospitals still have to pay the bills, right? So
Yeah.
that's what we're looking at right now.
Yeah. And Blair, I want to stay with you for another minute, because I think you're the star of today's conversation because you're on the front lines of this. You mentioned the movement up to 80%. Can you talk a little bit about the evolution of the Mountain Health Co-op with regard to traditional analytics or predictive analytics, maybe how you were solving some of the problems in the past, some of the thinking that you brought to bear, and I know I'm asking a lot of part pieces to this question, but I want the audience to hear the evolution of Mountain Health Co-op's thinking around how you're solving this problem before and how you're embracing AI now to address the same set of challenges.
Yeah. Um, Great question. So in 2018, I joined the plan. Prior to that, the only communication the members would receive was a member packet and their EOBs. There wasn't a lot of conversation with members, and that wasn't because it was overlooked. It was because when the co-ops got started, they were on such a tight budget, and we know that a lot of co-ops went out of business because they overspent, especially in the marketing area. So step one was really saying, what are we trying to tell our members? And if we are member governed in a mission oriented organization, what are the things that we should be doing? So we started communicating to members. I think a lot of plans fall into kind of blanket communication, sending things out. That helped our retention grow, but then we fell stale. And so when we started partnering with y'all at Siftwell, that's when we really started getting hyper focused on targeted populations, which on the deployment side costs a little bit more because it's more expensive per postcard if you do 1,000 versus 30,000, things like that. But the ROI on those kind of things was so great. And so that's where we saw that jump from high 70s up into the 80s was when we really started hyper targeting. And the thing that I loved most was Um, I was able to have a slide that said, this is the kind of person you're looking at. Here's what moves them. Here's the things they're into. And I could say, oh my gosh, this is what they're reading. They're reading this kind of magazine. Okay, this is how the language is. This is what they're, and that for me was an eye opener. And I mean, you should see my house because I get everything from AARP to Cosmo to Times because I love reading the things that our different demographics of people are reading so that I can understand the language. But that's something that AI brought to the table and easily allowed us to deploy.
Yeah.
I
I
hope I
love that
answered that.
notion. Go ahead, Blair.
Did I answer that correctly? Or not
You
correctly, but
did.
did I fully?
Absolutely.
Okay, okay.
Absolutely. And Blair, I love this idea of intentionality, really thinking about what is it that we're trying to say to folks before we just kind of blast. And I think that's so often, outside of the healthcare industry, in all industries, I think people don't take that step and it just skips to let's just blast folks. Blair, before we move on though, any other thoughts about immediate things that are on your mind as a function of the tax credits, or how you might be thinking about some of these strategies in light of HR1 or the changes there?
Um, yeah, I have a lot of thoughts. Um, and I would just say that as a plan, we are focused on retaining good business. We're focused on working with healthcare providers. I think that's often a piece that's overlooked. Consumers are really sick and tired of providers and payers going at it all the time, but HR1 has allowed us to say to providers, how can we work together? How can we send you the right members? How can we absorb your member? And I think that's a really cool synergy that's come out of that. So it's not all bad, but I'm really concerned about keeping this sick population only. I'm really concerned about in a rural state like ours, folks are driving several hours to get care. What's going to happen to those people who can't afford it and can't afford to drive places? And so those are things that are just on my mind constantly. I'm worried about drug prices. I'm worried about prior auths. I'm worried about a million things, as everybody on this call is probably losing sleep over.
Yeah. Yeah. No, thanks for that, Blair. We're going to turn a little bit and zoom back out. And what we want to talk a little bit about is, obviously the main thrust of today's conversation is retention. What I want to do now, though, is just set a little bit more of a foundation for the next part of the conversation. What are some of the use cases that folks are using AI in? Again, this is not related to SIFWell, but rather the entire landscape. And then talk a little bit about buying decisions. And from there, Blair, I want to go into buying decisions. How did you think through, buy versus build? And so with that, I'll go ahead and pull up a slide or two. And what specifically we're going to talk about initially is some of the use cases and some of the flavors of AI that are being used, and we'll talk about retention in just a second. But first one is kind of this notion of individual and ad hoc uses. Really safe to use this type of technology as long as it's outside of clinical or medical decision making. So these tend to be your use of large language models, your ChatGPT type tools, really valuable for decisions like how to think through marketing material or spin up a first draft of marketing material or job description. So that's the way to think about that first bucket. Next one is, in the middle and the back office. We are seeing out there use of AI technologies in the middle and back office, specifically around data aggregation, pulling together provider directory information, member directory information, but again, outside of the context of clinical decision making. Three is member experience. We're getting a little bit closer to the member now, and what we're talking about here is virtual assistants for members directly to find information on the website about plan design or benefits. Here, we're also talking about call center augmentation. So, live prompts between somebody on the plan side when they're interacting with a member and they're getting presented prompts to say, hey, make sure you mention this or mention that. But there's kind of that augmentation play, if you will. Then we start to get closer to the care provider enablement and the clinical decision making. These two get pretty close together, and drawing a hard line between them is sometimes difficult. But on the care provider enablement, think about next best actions, things that are baked into the care management platform or that are being used by a care management team. You've got remote patient monitoring or point of care prompts. And so think about, visiting your PCP and they're being prompted as they go through some sort of questionnaire about things that might be relevant to you. And then the area where it gets, really precarious and the human absolutely has to be in the loop is when you get closer to the clinical and medical decision making. This is decision making, for example, which a lot of companies have gotten in trouble for, but you've got implantable devices or things even like sepsis monitoring. Again, really close to the member. Renee, you grew up in an emergency department. Any reactions to some of this? I mean, you're also talking to a lot of plans right now, working with a lot of our client plans. Any reflections on some of these use cases or thoughts here?
Definitely a great question there. So when you think about it, just from a personal consumer perspective, we're all using technology and AI to take what we're trying to do day in and day out to a new level to make it easier, smoother, faster. And so now taking all of that normal personal consumer side into the actual workflow space of healthcare and being able to leverage our already known limited resources, limited workflows, limited staffing models, all the like, and being able to apply technology on top of that to truly make all of our superheroes in healthcare even stronger with even stronger superpowers. That's really how I see AI being used in healthcare. It's definitely more of an accelerator, not a replacement.
Yeah. And Blair, I mean, you're the CEO of a plan. You see all of these areas. Can you talk a little bit about some of the areas that you're either using artificial intelligence or thinking about the use of artificial intelligence in some of these vertical areas?
Yeah, so I think in one way or another, we are using AI in every area, right? Because we use a lot of vendors and our vendors are larger. They use AI. I'm using AI in everything I do with ChatGPT. Hey, shout out. You know what so I'm using it, we're using it to streamline. When I look at my role is to protect my staff so my staff can protect our members. We are very small, like most of the plans on this call. We have 60,000 lives and 40 employees. So from the back office side of things, how can we streamline? How can we use tools to help us make smarter, quicker decisions? From the member experience, we are using a lot of different AI on our portals. And that hasn't always been the case, but we've recently gone through a transition and we've made that a priority focus of how can we innovate? And if we're not doing it now, how can we partner with people who are willing to allow us to grow into that and test things out to make sure it's the right fit for us? Um, and then of course on the care side, we're using it through our medical management, utilization management. We don't use AI for denials, but we really use it to drive data decisions, especially on the risk adjustment side.
Yeah, yeah. And Blair, you mentioned specifically some of the existing members and them having embedded AIs in some of their platforms. And I think that's a great segue to some of the next, because, in recent conversations I've had with CIOs and other CEOs, this notion of like the vendor should be able to give you a credible, real, and valuable kind of roadmap to how they're thinking about embedding these AI technologies into some of their platforms. The other considerations I just wanted to pull forward as folks are thinking about looking at AI either for retention or more broadly for some of the use cases that you've talked about, Blair. We thought it might be helpful just to highlight a few things, key principles that I would be asking myself if I was back in my CEO job. First one's around transparency and accountability. This is really about making sure that you understand and the team understands why certain recommendations are being made. So if you're in the context of risk stratification or risk adjustment or even targeting for something like retention, why is it that the AIs are making certain recommendations? Really important thing to know there. Two, ask potential vendors around bias mitigation methodologies. So assess what methodologies are in place to control for those biases or those systemic disparities. So things like proportionality analysis. If on the inbound side it's 30% males, is it nearly 30% on the outbound side? And if it's not, it's fine. But what's happening there? If it's 14% African American members going in on the inbound side, what is it on the outbound side? And if it's significantly different, why is it significantly different? But making sure that there's detection devices in that are built into the system. Two, or number three, rather, on the vendor due diligence, just more broadly, make sure your vendor's got healthcare experience. It's a very complicated industry. I don't have to tell folks on this call, but ask about their healthcare experience and push. Ask about outcomes. Is this technology real, or have they just rebranded as AI as part of their marketing material? Three, talk about model performance under that vendor due diligence, and then make sure so as you don't get yourselves in trouble about familiarity with compliance, HIPAA and otherwise. Fourth area that we always encourage folks to think through is operational integration. How is this going to fit into the broader ecosystem? Now, Blair, you made an excellent point about folks that are willing to flex with your plan and build the things that you uniquely need. And so what I would say here is make sure that they can embed into solutions or are willing to eventually embed into solutions. This AI, the technologies that we're talking about are moving really fast, and not everybody's going to be integrated with an EHR or with facets or some other system that's currently out there. But at least know that they're committed to integrating with your existing ecosystem. And then lastly, it's not a one and done. Drift can happen in some of these AI models. Again, whether you're talking about risk stratification, member retention, these things tend to drift over time. And so ask them how they're constantly monitoring drift over time. And again, that's kind of related to retention, but in any other use case that we're talking about. Blair, with that as a foundation, what of these are most resonant, or what were most important from your perspective as you think about, selecting vendors or doing due diligence on vendors?
Yeah, this is great. I'm glad you put this together. I'm going to actually screenshot this slide. It's not going to be sent down before because I'm like, oh, I wrote a few of those down. One thing that I think that you didn't mention, but that's very important to me and my organization and all of the just looking at the names over here, and I know a lot of these people and the plans that they're with. I think the most important part is that whoever you work with has to be able to embed into your culture, because we often have a workforce that, they're at their capacity. They're taking on a lot. The last thing they want to do is work on an AI project. So you have to be able to have these people, your people, be trained in the language of AI and feel like they're brought along. And you have to have the people who are in the lab with your vendor. I always say in the lab on the vendor side with AI because you're building things and testing them. But how do the two work together
Yeah.
harmoniously? Because both are so critical to the equation. If you don't have curiosity and growth mindset within your team, your AI efforts are not going to go anywhere. But that's not to say fire everybody and only hire millennials because we're better than everybody else and we have that inquisitive side. Talk about the Beanie Babies. But how do you engage and have a vendor help bring out that curious side? What are the questions? If you had this data today to so and so, three rows down from you as CEO, four, if you had this data, it would make your job easier. Or if you knew X, Y, and Z, what would you be able to do with that? Right? Like those kind of questions need to be asked daily. And so that's important for me. I think on your list here, vendor due diligence, this compliance, HIPAA, I mean, you're going to be nowhere if you don't have an organization that one understands how healthcare works and how complex it is, and then be able to drive with on the compliance side, because you all know better than I do that we're getting called into our departments of insurance. We're getting another CMS audits and surveys every other day. And you have to have somebody who can back this up. So I think that is absolutely mission critical.
Yeah, I love that, Blair. And just a reminder for all the folks out there listening, and please ask questions. I thought that this one in particular, folks might have questions or feedback on, and we always would welcome those. Renee, you've been inside of hospital systems, you worked with payers, you rolled systems out. would love to hear your perspective on some of these. Where are folks getting into trouble, or what are folks talking about as the most important kind of principles on this slide to make sure that they're kicking the tires when they talk to vendors inside the context of retention or out?
I think that's definitely a great thing to keep talking through, because that is something I did in prior roles, was a lot of vendor management, being able to think through buy or build. And so it definitely is relatable for sure. The transparency and explainability is a big, big question. To be able to trust that you can understand, not just go and use this data because we say so, but being able to truly understand the why behind it is honestly something that historically I always look to. If someone can truly understand what they're building and why they're building, and being able to articulate that over, and that also helps with change management when you're introducing something new to your team, being able to explain the why. So that was definitely a top one for me. Also, the can't get out of the elephant in the room always, bias mitigation with technology and AI. That is something that is always looked upon, but that's where it's a great piece to where we're constantly challenging the technology, adding different perspectives, not just from the technology side, but also the human in the loop. So day in and day out, being able to say that you're not just using technology to check technology, but using a human in the loop to check technology, and making sure that it actually is looking at it from a non-biased perspective, I think is also another key perspective. So I would say those were the two that really struck out to me. But I'll definitely echo Blair's piece about the mission alignment. I mean, that is just so critical for sure. So love that piece too.
Yeah, good. Thank you for that, Renee. Blair, we had one come in from the listeners. It's quite they're throwing a fastball here.
Oh no.
Um, and but they did say not to increase your stress. But they're
Okay.
interested in hearing about the math you're doing around member retention. If there's a 30% loss in membership, how do you see the plan adjusting the remaining risk pool? How's that going to impact your quality scores, particularly if you've got a harder denominator to work into the numerator? So yeah, we've got a fastball inbound here.
Oh,
So
I love it. I love it. Did they say
I
if
knew
they're
you
millennial
would.
or not? Because there's
They didn't. It was
oh,
an anonymous one, so maybe it's one of the other plans out west near you.
so I guess I should clarify too, and I don't know how many of the other plans, what you're accounting for. We don't know anything. We think that roughly between 20 and 30%. We're thinking about 20% will fall off just given the costs in our area. We think between 20 and 30% gap are members who will buy down in metal levels.
Okay.
Um, so anywhere in that range. And we have talked to a lot of plans across the country who are anticipating the same. Milliman, we've just talked to a lot of folks that seem to think that's the magic number, but if actuary is off, that would be the first time, I'm sure. So how we are accounting for our lives. The co-op's actually in a unique spot that we grew very quickly over the last few years. And so we're a little bit less worried about growth this year as we are about staying steady, which given, knowing that this many might come off our block would mean growth. So what we have done is we've broken up our members, and I won't do the math because it will be wrong, but what we've done is we have broken up what our members look like based on what they add to our RBC and to our risk. And so with that calculation, we have targeted key zones that we will be pushing all of our marketing to. And so before we did not blanket, but we had pretty even marketing across the 3 states. We will now be hyper focused on very small spot in Idaho and then a couple key spots in Montana. Now we've done that based on, I talked about RBC and then the risk adjustment calculation and where we're getting how much each member's worth. That
Yeah.
is so sad to say. I hate saying that, but how much each member is worth to the plan, but also what of those key quality scores that we can get. And so with the target marketing, we are going after based on our value-based drug program. We know that folks with diabetes, when they come and our quality scores go up by X, we know our risk adjustment goes up by X. We know that we offer these free drugs to these key areas. And so that's how we're pushing it out. And we've got a matrix of all of our rating zones, and then we've built our own, I want to say like a equation based on all of those factors and our provider contracts within those factors. I hope I
Yeah.
didn't butcher that. That was,
No,
but whoever that
good.
is,
Yeah.
if you want to reach out to me, we can talk specifics and I can share with you the maps and all the things that we've been doing. Happy to do that.
Yeah. No, Blair, that was a very clear answer. And, I mean, I think it underpins the importance of taking a thoughtful approach, leveraging technology where you can. And so I just want to applaud you for your approach to that. Speaking of the, kind of rolling out or the application of technology in the space of AI retention, all the rest of it, Renee, what I wanted you to do now is talk through AI in action, if you will, some of the frameworks that are available to folks. And so I'm going to advance the slide, and I was hoping you might talk us through what we've got on the screen here.
For sure. No, because definitely we all know that data and insights are only as good as you can use it. And so how do you actually take that within your own teams, within your own workflows to that next level? And so that's kind of back to one of the other pieces, that operational integration, right? Not only just within your system, but truly within the workflows of your team. So this is how we get started. This is how technology really can take your team to the next level. Looking at it from that truly holistic view, doing a true zoom out to say across your membership, looking at pockets of populations that you can truly make an impact on. And in this case that you're seeing here in the visual, it was related to impactability as well as their average PMPM. And so being able to really target down into a very precise action piece to say, with this membership, I can tell you not only just, of course, we all know demographics and what have you, but also looking at it from a utilization perspective, a churn risk perspective, on top of being able to see from the consumer side, right? How are they actually interacting? Do they have transportation issues? What are their physical and behavioral health conditions? And that's where you start to then really have the more precision-based decision and impact that we can then even show if you go to the next one too. We can then say, from that zoom out perspective, we're now saying from one of those bubbles that we're saying that we wanted to now take action on, we can actually go into, this is a real world demo example, but a real life type example. And Blair was even saying, oh, you can actually get to that precise down. Yes, that is the great piece of technology that we can leverage. Real example, this is, female, 89 female members, aged between 60 to 65 who live in areas of low technology adoption and limited public transportation. When you think about that, that's where you're saying, okay, maybe they're not showing up to their, PCP visit because they just didn't want to. It might be because they have lack of transportation. Or with the situation with low technology adoption, maybe it's not that they're not answering my, SMS messages or email. It might be because they do not really use technology in the day to day. So it's taking a step back and being able to understand your members and meet them where they are to really truly understand what they need to move the needle. If it's medication adherence, if it's, closing that quality care gap that we all hope that they do. And so it's just taking that more curated, holistic approach to truly make the impact on the members that we all are trying to do. So it definitely starts with knowing them from a much more holistic approach.
Yep. Good. And Blair, I mean, you talked a little bit about, matching members with messaging. There was the example that of a marketing campaign that you ran where we identified some high degree of followership or interest in rodeos. Can you talk a little bit about that to bring this notion of precision or member matching with messaging home a little bit for everybody listening in?
Yes, I think I'll try. So yeah, we did do a project with where we were trying to figure out who our people were, and we did figure out that they were part of this rodeo circuit, which led to sponsorships and whatnot. But if I could, I'm gonna just share a different story because
Yeah, please.
I think given where we're at today, I think is more meaningful to me. So it was a while back, we had you run I don't even want it's like a run a scenario. I don't know what the technical terms are. See, everyone on the call, you don't have to be a pro to know, but I don't know. So you ran a scenario because I wanted to know why women weren't getting mammograms.
Yeah.
Because that's something near and dear to my heart. And you found a couple things. First of all, you found that in a lot of our rural areas where we didn't have Medicaid expansion and there wasn't a lot of health education, that alarming amount of women were saying things like, oh, mammogram, when you go into the mammogram machine, that's where you get cancer, right? Like things like that. Like what? Like to people on this call, that is so, like, how could you even get there? But the more you hear it, it's so like, wow, that's for us. I was so taken aback that I needed to reframe my own mind, because I think we get going so far and we just expect people to know certain things and they don't. And that was a huge wake up call for me. So part of that was we did a huge education effort, which we increased ladies going and getting mammograms. But two, what you found was that um, women couldn't get rides there. They couldn't afford it or didn't have a car, and they didn't have childcare. And so we were able to fix both of those. We were able to find a vendor with Uber Health, and surprisingly, they operate in Wyoming, which is wild to me because I thought they were just in bigger hubs. But we were able to get women to those mammograms, and we were able to help on the childcare front. That's important to me because whether or not somebody's hearing a message at a rodeo, which is equally important, but to me, if you can show somebody that you care enough to go the extra mile to get them where they need to go and help them take care of their kids because you believe that moms are a part of our community and that they serve a greater purpose, like that's life changing. That's a big freaking deal. And we have been able to do that. And I could go on for days about some of these things that we've been able to do, not just with women's health and mammograms, but brain cancers and diabetes and things that matter a whole hell of a lot to the people who we're serving, and maybe not as much to those that we're competing with that are for profits. But
Yeah.
um, things like that just one make you feel good. They have your team believe, when I'm talking about culture and buy-in with your team and whatever AI vendor machine learning you're doing, that's how you get that buy-in. And that's how
Yeah.
you change, especially rural health for me.
Yeah. Yeah. Blair, it's one of the reasons that we love working with ACAP plans. Still predominantly, I think over 75% of our clients are ACAP plans. And so we're really proud of that. And it fits, really well with the mission of our organization. Renee, as you're listening to Blair, again, you work with almost all of our clients you work with all of our clients to varying degrees. As you think about the story that Blair just shared, are there other things that come to mind about the stepwise function or the quantum kind of jump in some of the available AIs out there versus traditional ones, some results or some anecdotes that you can point to about the application of these technologies in the space of retention or otherwise?
Definitely. So I love that story, Blair, by the way. It's the heartwarming ones that we're able to repeat too. I'll even add one more for co-op before I jump to another one, because it's another one that I think, especially as a nurse, I just remember all of these stories, was the one around colonoscopies as well, right? You say the word colonoscopy, a lot of people just cringe. They are embarrassed by it. They don't want to be screened for that type of cancer. They don't even want to, be willing to even say the word. And so being able to highlight the needs there, do they even have a screening facility close by? Or would they actually benefit from having a screening kit sent to their home? And being able to give that kind of data-driven decision to you and your team, I think is what really shows that holistic approach to a member, right? That to where they feel the safety of their own home and being able to once again just meet them where they are. So that's just another example that I love, that we can truly work together on that. Another one, just switching to even other lines of business and other clients that we've worked across, especially with retention, especially in that specific piece is also related to, it all starts with engagement, right? So being able to actually reach the member, engage with them is how you can help them act upon what you need for them to better their clinical experience, to better all of the things that we all hope to do. And so there was a client that we were able to take the way that they outreach to members, not just a phone call, but actually what they knew to say to the member once they got them on the phone, and being able to truly guide that, true script to the member to get them into facilities for PCP visit, for wellness visit, and immunizations, and being able to make that change for them. We were able to see a 3x jump just in the way that we were able to prioritize those members and also knowing that they needed to call them specifically for a wellness visit and immunization. I think just being able to showcase those small pieces to the puzzle is really what is taking healthcare to the next level for people. Because you get them on the phone, great. Now what do you say next? And being able to guide them on what to say next is really where we've helped see the lift a lot with our clients.
Yeah, I love that, Renee. Blair, every time I hear you tell the breast cancer screen one, that also is very meaningful to me. Both my mom and sister are survivors as a function of early detection, and so that was a really cool opportunity to work with you and your team on that one. So results are super exciting. The results that you've gotten, Blair, across the retention, across cancer screening, and some other areas, just phenomenal. I want to switch now, talk about how folks are getting those results, how to get started, and some thoughts around how to begin marching down the path. Also consistent with CIFWell's mission and our commitment to the community health plan space, we are seeing the bigs embrace this technology. And when we do have these conversations, this is our small way of trying to help accelerate some community health plans thinking around what technologies are truly working, where are you getting actual results. And one of the ways that we do that is by talking about how to get started. And again, not CIFWell specific. I think that's always important to mention. The motivation here is educating folks or building awareness broadly across the AI technologies. First thing I would say is start soon, start small, and expand deliberately. We talked a little bit about the lower risk areas. When you think about AI, don't skip to utilization management. It's a really risky area. Don't skip to clinical decision making. Start small, start in a low risk area, and then get the team acclimated to those technologies. Think about the use case for, Blair, I know you operate in a rural state. I too had some very rural counties in North Carolina that we were responsible for. Think about your social workers going out, doing visits, and then having to go home, prep dinner, put the kids to bed, and then capture notes afterwards that they had throughout the day with their members. Why not embrace ambient listening there, where some sort of AI can capture those notes, and that social worker or your LCSW or whoever was interacting with your members can actually review those, but they're pre-processed, and then there's kind of a checkbox or sign off. Really low risk way to embrace technology. You still need review, obviously, but again, an opportunity to get started. And CIFWell doesn't do that work, but we know folks in that space if it's helpful to folks listening in. To identify big, low risk problems. So I've already talked about this a little bit, but some more examples is around member engagement, retention and product awareness, population engagement. So thinking about how to reach hard to reach members, resource to member matching, that would be another good one and fairly low risk, as long as you're not talking about clinical services, but it's more about the transportation benefits, meal delivery, social connectedness, things outside of the direct kind of medical or clinical areas. Next up, convene a multidisciplinary team. Think through who the folks are that are going to have to embrace it, put it into the ecosystem, and allow it to go live. Four is always keep the human in loops, even if it's not in the realm of medical. Keep humans in the loop, and then start your roadmap. Where are you going to go from there? All of these things we're happy to talk to folks about. Some of the areas that CIFWell works on, some of it we don't. I know Blair's already offered to make herself available, and so we'll just make that a standing offer. Renee, Blair, as you see this, can you talk about your individual experiences at various steps? What went easier? What did I forget to cover? Any thoughts on these kind of these chevrons here, moving left to right?
Yeah, so I would even take a step back. Renee, I know you're going to add like a ton to this probably from your experience. I would say from like the dummies guide to AI machine learning point of view, start using chat, or there's a bunch of them, on your own just to learn. I'm not asking you to send your legal documents to there. Please don't do that. But start talking to chat to understand how it works, right? Like that's a safe space to do that. I do it all the time. I'm sure everybody on this call, here's one way I do it. I get told to read a book at least once a day. Like, oh, have you read this? You should read it. It's game changing. And so I put the title of the book into chat and I say, give me the Cliff Notes version and how I could apply this to my life, because I don't have time to read 300 extra pages of fluff on somebody's childhood in farm town, in their farm town. I don't, but I want to know what it means, and I want to know how to apply it. Or sometimes I'll say, what are some meaningful questions I could ask my staff about this? Or I'm presenting this to my board, poke holes through it. What are the questions they're going to ask, right? So just start getting comfortable and familiar with machine learning and how it's learning you. I mean, don't be one of those people that relies on it and falls in love with it, but be the person that you can learn and absorb, just so you can get comfortable with it. And then I know how Trace said identify the big problems, but from my perspective, the thing that was most impactful to me was, if I could, here are the things that are taking up the most amount of my time as a leader.
Yeah.
That was it. I made a list. And then from there, I said, what data or what would I need to get this off of my plate? So it just like kind of started, the question started bringing it down. Get back to basics. Just get back to the very, very basics of what's going to make your life better, because then you're bought into it and then you're learning it and then you can teach it and apply it elsewhere.
I love that, Blair.
Yeah.
Renee.
Yes, I would say definitely want to jump in here because I love that, Blair, for sure. Change management. I mean, we all say that we love change, but in reality, it's hard to, move to the next step. But you actually can do that zoom out. And what I love to do is the first one that starts small, right? You don't have to boil the ocean. Let's start with identifying your biggest pain points, what keeps you up at night. That if you put like kind of everybody calls it something different, a strike team, a tiger team, whatever it may be, some cool catchy name. I bet somebody will come up, a Beanie Baby team, whatever you want to call it. Start small. That's actually how, just in, past roles, how I even work with clients. If we can do a targeted action, a certain amount of members that that your team can actually move the needle on, and it starts with engagement. I'll go back to that because I'll never let that go throughout my entire life, is that engaging and that experience. An engagement experience is what really sets the tone. It sets the tone for your plan, it sets the tone for your mission. And so being able to do a targeted cohort with a targeted team and then being able to really get them on the phone, that's the start small. It might not be a big chunk, but it's going to be a very meaningful chunk. And then you'll
Yeah.
start to see that ripple, effect, which will then make the team buy into it. Then they'll want to do more and be able to really help go to the next cohort and help those members. So definitely start small, start with not only a small membership cohort as well, and just that small set of problems, start with member engagement, and you'll be definitely eyes open to see what happens from there.
Yeah, good, Renee. Blair, going back to your point about personal use of AI to get yourself kind of up the curve. I've got a personal rule. If it takes me more than 3 minutes to do anything, I should probably be trying it on some sort of LLM or some sort of AI. Doesn't always work, but it's kind of a good forcing mechanism. Almost takes me back to when I was, a baby CFO working in Excel, and I had to learn the formulas or relearn the formulas and the shortcut keys. If you take the time to force yourself to get acclimated to these new technologies, it becomes second nature in a lot of ways, and it becomes a very useful co-pilot at the individual or ad hoc level. So with that, Blair, we're coming up on AEP. what are you thinking about in the context of retention? What would you advise folks to be thinking about over the next 90 days? What's on your mind? What advice would you have for others?
Um, ugh, gosh, bleh. It's a big one. I think the more prep you can do now, and things are changing. I mean, every day CMS is saying, hey, we're going to change this or new AV calculations or whatnot. How do you control your controllables? And for me, how do I keep these people? How do I identify who I'm keeping, who I absolutely have to keep?
Yep.
I need to know everything about them, and then I need to be able to go after them strategically and systematically. And then who do I know is going to drop off of other plans that I might be able to pick up, and why would they be dropping off, and how can I pick them up? I know price is the number one, but other plans are doing some other funky things in our area as well. So how can I make sure that they know, we have the out of state wrap or all those little things that other people aren't doing? How can I exploit that and make sure I get those members? Because it counts, right? Like I mean, I hope we're all freaking out together about this. And then how do I be a good steward of our members' dollars, and how can I work with partners and other organizations to make sure that we catch those people that aren't going to sign up? How do we build a net? That's
Yeah.
important.
Yeah. Blair, you mentioned everybody freaking out. I think you're exactly right that everybody is. Renee, again, you're working with a lot of plans right now, and you're experiencing that firsthand. What would you say to one of our clients right now over the next 90 days? What should they be thinking about with regard to growth or retention right now?
That is a really good question. For sure. But definitely something that we've been in conversations already with a lot of the clients there regarding that specifically. And it's first and foremost is being able to understand your members at the member level. Not just at the macro population level, right? Because what people are really accustomed to is just looking at it from the macro level and only a subsection, but instead being able to get down to the member level, being able to, I mean, it's emphasizing exactly what you said, Blair, because that's the great piece is showing that you know the member to their core, you know all the things about them to where you can truly engage with them in a more precise targeted at like fashion versus just a peanut butter spread, and all of those even terms that are never fun, right? Like when you get reached out to, you want someone to know who you are. And so that's where we're trying to make sure that we are focusing on members from that perspective first, and then being able to then segment them down into different ways that are meeting the strategy and goals that they're hoping to achieve.
Yeah, awesome. I would agree. Get to know your members, figure out how to communicate with them what they need, put those action plans in place, and get cracking. We're on the eve of a lot of this. So, with that being said, we didn't get a lot of questions today. We just got the one, that kind of fastball. But what I will say is, I'm easy to get a hold of. Trey.Sutton or Trey@siftwell.ai. Renee's same email address, renee@siftwell.ai. Blair, I'll leave it up to you whether you want to add yours to that list. If folks have questions about today's conversation, if they're curious about AI, if Renee or myself, Blair, can be helpful in any ways to the rest of the ACAP universe, we'd love to be. I'll also say if anybody wants these slides, let us know. We've also got an AI buyer guide, which is not about SIFWell. I feel like I always say that, but my motivations are genuine. I want the community health plan space to survive, and I'm worried about it right now. But it's a document that will help you suss out where the snake oil is and where the real McCoys are, so to speak. We're happy to share that with anybody on today's call. Renee, super appreciative for you joining today. Same thing with you, Blair. We're always grateful for your willingness to share your expertise and point of view. Anything to add, you two, before we wrap today's call?
I would just thank everybody, and I'm Blair at mhc.coop. You can find me in the ACAP, in our directory, but happy to chat about that or numbers, membership, just build a coalition of those of us who are terrified of what's going to happen in the next couple of months with our members. So feel free to reach out.
No. Coalition of good peeps. Let's go.
Yeah.
Let's go build it. All right. Thanks, everybody. Have an amazing
Thank you,
rest of the week.
everyone. Take care.
Okay, I want to thank everyone again. Just a reminder to our plans that the slide deck and recording will be posted on the website by tomorrow morning. So I thank Siftwell and everyone part of the team today for a very informative webinar. Thanks again and stay safe.
Thanks, Ron. Take
Bye.
care, everybody.